can you summarize what AvoMD does as you would explain it to a 5-year-old in only monosyllabic and bisyllabic words?
So let's see. No code. So you don't need to use programming language to be able to contribute to building it. This means that for health systems, you can take your pathways and put them into the hands of your clinicians in a way that standardizes care, where your clinicians can access effectively something that's like up to date in MD Calc format, but can be edited almost by using SurveyMonkey, right? So it's really like a combination of those three ideas. And so for health systems, we're standardizing care. For providers within these provider organizations, we're making care more efficient and more effective because we can produce notes for you as you go through these pathways. We can do lab interpretation for you. We can help you with diagnosis and management, right? Anything that you need at the point of care, pre-filled prior auths, right? Any activity that you need to do, it can help you and therefore save you time. For societies, the ones that are producing these 150-page guidelines that are supposed to help people figure out what to do with whatever.
I read all of that.
Yeah. I think you're like 99% of the world also that reads all of this. No, it's okay. No one does, I think, except for me. Like even some of the guideline authors tell me like, yeah, I didn't read like the final version. It's just too long. It's like, I get it. It's like, so how do you make that usable? Right. So you work with us also to be able to actually make that usable for these guys. And then finally, life sciences. So the guidelines have drugs that are already inherent as standard of care. It already has medical devices that are inherent as standard of care. And once it's produced by the societies in our format, it's blocked, it's sealed, it's done. And so that means that if life sciences want to help distribute it, it's almost like they're just giving out the guidelines themselves. And that's totally fine. It's not like they're creating it or making it have their drug in it or anything like that. There's nothing nefarious. So that's allowed us to give that value now to life sciences to have a compliant way and an effective way to get their drugs and medication and their medical devices to the point of care, to the physicians, to the nurses, to the clinicians that are there at the bedside in the clinic, and actually have it as part of the pathway when it is standard of care already. So that's kind of the value of Avo. And in a word or in a sentence, it's a no-code platform for clinical decision support apps.
I understand the value that Avo brings because there's I just came off cardiology and there are so many different, I guess, guidelines for different presentations. So for example, someone came in with a pacemaker and ICD, and I haven't studied that. I don't know exactly how to manage that, but for a fellow, you have to know everything. And those guidelines change sometimes as devices evolve, et cetera. So to be able to update them, live and to not have to read through a 150-page guideline is super helpful. But again, I don't know what kind of 5-year-old you're speaking to.
Talking to a 5-year-old that has been there. I'll give you my pitch for a true 5-year-old.
Okay.
It goes like this. You use a phone, right? And when you use a phone and you're trying to figure out something, you have the option of using like 10 different apps to do it. That means you have to go and download it and go through all these things, or you can click into one app that has everything that you need. Not only that, but that one app that has everything that you need, you can actually change little things in it to make it sure that it has everything that you need, no matter where you are. If you're at one place or a second place or a third place. Now, obviously, we're talking about making medical decisions, being a better doctor. You can be that better doctor now by having it because you're just empowered to practice at the best level of your 5-year-old self. So we're basically solving this problem for you of needing to download all these disparate apps. I shouldn't use the word disparate, but all of these different apps. And now you don't have to. It's all there together for you in a way that'll work for you.